Dear Prime Minister, Deputy Prime Minister, Secretary of State for Health and Social Care and Minister for Care. It is encouraging to hear you all recognise the vital role of social care and care professionals in your speeches last week at the Labour Party conference. Given your family insights and experience in supporting the most vulnerable, you understand the crucial role that care work plays in helping individuals, families and communities. I have been a care professional since 1986, aged 16, when I started my career looking after a profoundly disabled child as a mother's help. Like Angela, I too come from humble beginnings, a single parent family living in a council house with my mum as a nurse. We too worked for care providers with some questionable employment terms. So we started our own care provider, being our own workforce, to make a difference and serve our community. I truly understand the challenges. Since we started, we have grown and now deliver over 20,000 hours of home care per week to around 1,500 people in our communities. Over the years, I've supported 3,800 staff to gain qualifications, enabled 138 staff to develop from care workers to managers, senior managers and directors, providing them with pathways out of low-wage work. I'm really proud we have made a significant contribution to employment and economic growth in our community. I wholeheartedly agree that care professionals should have the same respect as a Prime Minister or other prestigious roles. Our teams were delighted when we had a weekly clap for carers during COVID. We all felt that a change to their recognition was coming. It didn't, and again, they feel forgotten. While I acknowledge the concern around 0 hours contracts, we provide all of our workers with a contract option. They can choose either full, part-time, salaried or 0 hours. Despite these concerns, 35% of our workforce opts for 0 hours. If we deny care professionals this choice, we could potentially lose 153 of our experienced trained care professionals who currently provide 3,800 hours of care per week. This would leave more than 380 clients without any care at all. Most of the services we offer are to local authorities and NHS continuing care. The CQC rated us as outstanding, and I believe that everybody deserves outstanding care, whether or not you can afford it. But the challenge here is the need for a robust plan for how the government will fund local authorities and NHS to deliver these new terms and conditions. 70 to 80% of our costs are for pay and employment terms for our care professionals. We want to do even more for them, but we'd go bust if we tried to do so without an increase in the fees we receive from councils and the NHS. Without a clear funding plan, we will end up in the same position we were post-COVID, with a faint sound of weekly capping long forgotten. The Fair Pay Agreement for care professionals is a critical step forward, but it must be backed by a solid financial strategy. If we fail to negotiate a fee increase from our local authorities who commission our services, or if they lack the finances to agree to a £15 per hour increase to our care professionals, we will incur a loss, making our business operation untenable. A well-funded plan would not only support fair wages, but also enhance service delivery by attracting more talented individuals to the profession and reducing turnover rates. The stability is crucial for maintaining the high standards of care that our clients expect and deserve. I ask you to consider these points as you develop the funding mechanisms for this policy. Our care workers have shown their commitment to our communities time and again. It is now for us to show our commitment to them. In addition, I would like to emphasise that care providers are very collaborative and we are ready to work with the government to support these changes. We are willing to engage in constructive dialogue, share our insights and experiences, and contribute to the development of policies that will benefit both care professionals and those we serve. We look forward to your continued support and action in addressing these concerns and ensuring that our care professionals receive the recognition, respect and remuneration they rightly deserve. Sincerely, Camille Leavold, CEO and co-founder of Abbots Care and non-exec director of the Home Care Association.